Thank you for joining us today for our Lunch and Learn. It's front office training, case acceptance. Very pleased to have Ashaunte Trent with us today. I'm gonna go ahead and hand it over to you. Thank you for joining us.
Wonderful. Thank you, Jim, for having me. I appreciate it. It's great to be here for another webinar. So I hope to make this one as amazing as the last one. I know last one we talked about doing sales. So that's what today is all about. Now, typically, this is usually maybe a 2 or 3 day training session that I do with my clients, and I am going to attempt to give you high level meat and potatoes today in about 40 minutes, and then open up the last segment of this webinar for any questions, any follow-ups, or even any role play or scenarios that you might want to pull from your actual office to see how you can apply these techniques. So since we do have a lot to go over today, I am going to just jump right on in, okay? Okay. Today we are focused on the art of case acceptance, turning conversations into actual commitment from our patients. Give me 1 second. I only want to share the screen that I want. So sorry. Here we go. Are you guys able to still see my screen or has it gone away?
We have your slides, yes.
You are okay, perfect. Everything is still good to go. I just want to make sure you guys can see everything on my end.
Yes.
Okay, perfect. So this is the art of case acceptance, transforming conversations into commitments. These are going to be communication strategies that really drive your patients to say yes. One of the biggest complaints that I hear a lot of offices say is that we need to get more patients to say yes to their treatment. One of the biggest mistakes that I see a lot of offices do is that we sometimes talk to patients as if they are familiar with our services and with the level of care that we present. So I've been able to take this information, turn it into bite-sized pieces, and make it digestible for team members like you, offices like yours, but also for my own practice that I currently still manage, and all of my clients as well. If you use the techniques that I'm giving you today, um, I can assure you that they will increase your case acceptance. I have used these techniques and formulas now in my own practice. I have increased my profits by 300% within a year, all by using these techniques. I'm able to take these same techniques, use them with my clients, and increase their profits by 100 to 200% in a matter of 90 days, right? So these are proven techniques that have been used and still are used today in real time. So our objective is we want to uncover the hidden reasons why patients hesitate to say yes. We're going to learn communication shifts that increase case acceptance. And then we're going to focus on master, simple, intentional language that builds trust and value. And these techniques are going to strengthen your team's confidence because that's the best way to sell anything. And it's going to allow us to be consistent. So this is great from an office manager, CEO point of view if you want to have consistent numbers inside of your practice. So these are the reasons why patients typically say no. There is an emotional and psychological block that stops patients from saying yes to healthcare, right? Most of the time it's due to time, fear, or finances. But there's other objections that are happening inside of the patient. Most people don't want to spend money on healthcare services, not unless it's something that they really, really, truly want, like veneers or a whiter smile. But I've never heard anyone say, oh my God, I can't wait to buy that root canal today, right? And so we really are in a profession where people are not really eager to buy what it is that we are selling. But the three major objections that your patients are going to have is time. Will this fit into my schedule? Fear. Is this going to hurt me or cause me pain? And then finances. Can I afford this? Will it fit into my lifestyle? I have other bills that I need to pay that seem to be more life threatening than this crown that you're trying to sell me on. right? And so things that motivate patients to buy. So when you know why they don't buy, right? Then you can focus on, well, why do they buy? It usually has to reduce or alleviate some type of pain. Imagine an emergency patient comes into your office, they have excruciating pain. At that point, they don't really care how much the procedure costs. They're like, just take me out of pain, right? Or it promotes pleasure. So maybe it is the Hollywood smile, the veneers, the whitening, the Invisalign, right? Maybe it is the implants that's going to get them back their teeth, that's going to allow them to chew and function. Maybe it is the scaling and root planning that is going to allow them to have a fresher breath and allow them to kiss their wife or their husband again, right? Or some people make decisions logically. It just has to logically make sense to them, which means you have to explain it in a way where they will understand it and they will get to say yes. Okay. So here's the patient's buying journey, right? This is an important factor. People buy because they like you, they know you, and you trust you. So let's say we're taking a complete stranger and they are being introduced to your practice by way of website or ads or word of mouth. They become a visitor on your website. All of this is helping them to like you, know you, and trust you before they do any type of call to action, which is call you, text you, or email you, right? So if your ad and your websites are set up phenomenally, right, which most of our websites are, now, when they call, email, or text, you have to continue to build on that like, know, trust factor. So that is one of the ways, right? That is one of the three ways where building that trust is super important. The next step in the conversion process is the patient has to schedule, right? Just because they call or click on a lead, they're not technically a patient yet. They have to actually schedule the appointment and then they have to actually arrive. So that's another conversion point where now they are arriving in your office to say, hey, okay, I want to explore this office a little bit more. I want to see if they have what I need in order to take care of me. So all along this process is super important to have conversations with them, again, that build on that like, know, trust factor. Then once they come in, now we get to the part where we've done the exam, we've taken the x-rays, we are now communicating to them about what we're seeing inside of their mouth. Hopefully at that part, we're not really talking about solutions. We're really more so focused on the problem, diagnosing what it is that we're seeing. Okay. So these are the three most important parts that will make or break trust. The conversion part, where they're over the phone, the next conversion part, where they're in your office, the next conversion part, where you're talking to them about the actual treatment. Because ultimately, what we're trying to get them to do is become a customer. They don't become a customer or they don't become a patient until they actually say yes. What indicates that a patient is saying yes? They've paid for their treatment. Whether they pay for it in full, they put a 50% deposit, or they decide that they're going to try to do some type of financing in order to help them cover the cost. But that's how we know when someone has says yes to their treatment. Okay. And so how do we do that? By having real conversations, I think, that build rapport, that build that trust, that gets them to like us and gets us to know us. Now, I'm aware that this is very, very small. So this is my new patient scheduling guide. I use this as a guide for my team and for my clients, that when a patient call and they have been identified as a new patient, your team member grabs this new patient scheduling guide and starts asking them the series of questions that's on this guide in order to, again, build that like, no trust factor. And I'm just going to switch my screen really quickly. Okay. Is everybody able to see the new patient scheduling guide that I currently have on the screen before I continue?
We have it, yes.
Okay, perfect. Okay. So this is the new patient scheduling guide, and I'll blow this up a little bit more. As soon as we have identified that it's a new patient, my team has a scripted guide on what to say to that patient. Not only are we creating consistency on how we handle every call, but we're going to ask some key questions here that again probe and dig deep and uncovers any future objections the patient might have once they actually reach our office. So this is just over the phone, right? So we, of course, we get their name, we ask them for their number. Have they been a patient before? Their referral source, some of those important things. But this is the juicy part, right? What prompted you to call us today? I want to know in the patient's own words, what is it that they're looking for? I want to be able for my office to manage their expectations and manage ours. Is it a full exam that you're looking for? Are you in pain or having an emergency? Or are you calling about a consult? That's a super important question. Then we're going to get some more insight as well, like where is that pain, location, etc. But here's another question that's super important to ask over the phone. When was the last time you were at the dentist? And when was the last time you had a cleaning? This is going to tell you or give you some type of insight on how important this health is to the patient. If someone that says it's been 5 or 10 years, sometimes they can indicate that a person is afraid. And so now we're probing and we're finding out a little bit more about this patient and what potential objections they might have. So later on, if they do arrive at the office, now we have an understanding that, oh, this person is just afraid. It's not because they're super neglectful, right? They're just afraid and they're looking for an office that's going to be compassionate and caring and acknowledge the fact that they are tremendously afraid of the dentist. When was the last time you had your cleaning, right? Is this someone that only goes to the dental office for emergency care? Or is this someone that stays on top of their oral hygiene, right? The next question that I think is the most critical on this new patient scheduling guide is, will you be utilizing dental insurance? This opens up the conversation to tackle finances. Again, time, finances, and fear are the three reasons why a patient won't move forward with treatment. So let's tackle that from the beginning. Will you be utilizing dental insurance for your appointment? And now let's get all of the information. Here's another question that is super critical and sometimes super weird when you ask it. But we ask, is there a spouse that you like to bring with you that's going to help you make financial decisions? You guys, if you've worked in the dental office long enough, you have probably seen it where you present treatment to a patient and then they say, I have to think about it. I have to go home and talk to my spouse. So again, because we know that, now we can adjust our case presentation. All of this is case presentation from the time that they call us and make the appointment to the time that they arrive. We are building up or opening up or creating space for that patient to start to get comfortable with talking to us not only about their care, but what objections may be. And of course, that's going to be finances. So, is there someone that you want to bring with you that's going to help you make financial decisions? This question throws patients off guard when you're talking to them on the phone. And when that happens, I like to say to them, most of our patients, if they have a spouse, they do have to talk things over with their spouse about it. I see that it's been 3 years since you've been to the dentist. You've said to me on this call that you're having some sensitivity, you have some chipped teeth, you know you need some work done. It's best that you bring your spouse in so that way they can receive the information at the same time we're giving it to you and you can make the informed, educated decision together. It can sometimes get difficult to regurgitate what we're saying to you in the office and then repeat that when you go back home. If you explain it in that manner, most patients get it, understand, they'll either commit to bringing their spouse in or they'll say, I don't have anyone where I need to run these things by them. Right. This also helps that when they do come into the office, because this gets scanned into their chart. So when they do finally come into the office and they make it to the part where we're discussing treatment and they say, I have to go home and talk to my spouse, we can sort of bring that up again. Oh, I thought, Mr. Johnson, that you didn't need to have Miss Johnson present with you today. No worries. Can I give her a call? Right? Because our goal is to get that patient to say yes while they're in the chair, while they're in the office. Studies show that as soon as that patient leaves the office, your case acceptance is likely to decrease by 50% because it's out of sight, out of mind. Okay. And I'm just going to get back to my PowerPoint. Give me one second. Okay. So that is the pre-consult. Those are some words to warm up your patients. Now, once that patient actually arrives into your office, we don't just swoop that patient back into the chair and start, working on them. We want to continue to build that like no factor and build rapport, right? We also want to dig in and probe a little bit so that way when the doctor comes in, they have more information to go off of in regards to how to best help that patient that's in front of them. So I have something called a pre-consult interview that my team also breaks out as soon as that new patient arrives for their appointment. We take them into a private area. Hopefully, your office has a treatment room. It's super important to understand that patients are leery about talking about their health in an open setting. Also, they are very, very leery about talking about finances in an open setting. So hopefully you have a treatment room or office that you can use, but you want to take that patient into the room and then you just want to ask them a series of questions. This isn't meant to be robotic, okay? This is meant to build rapport. We want to have a conversation with the patient. So we're framing, these are just questions you can ask to start to frame your conversations with the patient and get them to open up, get them to relax, get them to trust us, like us, know us, so we can help service them. Let me go ahead and blow that up as well, because I know that that image is super tiny. Okay. Can everyone see the screen that says pre-consultation interview? Okay. So pre-consultation interview has just 9 questions on it. Very simple and easy. So patient comes in, you sit them in the treatment room. I'm just going to use, fake patient Mrs. Johnson. So, Miss Johnson, I know that you gave us a call. You spoke with me over the phone. You said you were looking for a comp exam, and you had a couple chipped teeth, etc. But if you could tell me in your own words, what are your expectations for today? And we jot down whatever the response is next to that. Now, Ms. Johnson, have you ever been to a dentist before where they talk to you about any outstanding treatment or any services that you might want to get done? And if so, what happened? And then we'll talk. So sometimes you'll get patients say, yeah, I went to another dentist. I was trying to establish care. I didn't like that office. I didn't like how busy it was. I didn't like the doctor. I didn't like the team. They weren't professional. The fees weren't, disclosed. Whatever their, concerns were at the previous office, they'll usually give you insight. Or they'll tell you, I'm looking for a second opinion. I did, but maybe the fees were too much. So they're going to give you insight into why they said no to that office. And this will give you insight on how they can say yes to your office. Okay. Now, if you have any teeth that can be saved, would you prefer to save them or would you prefer to remove them? This is a super critical question. Some patients, they would rather just remove their teeth. Some patients, they want to save them. You need to meet your patients where they are at. So if they would rather remove their teeth and just have dentures or partos, right? Then that's going to help you develop the treatment plan for them a lot quicker than trying to sell them on implants or all on fours, something that they don't even want, something that they're not motivated to buy because it's not a care for them, right? So this question can sometimes be weird for patients, but it is a critical question to help you get into the mindset or the psychology behind why this patient would say yes or no. Have you ever had a negative experience in a dental office? So, Miss Johnson, have you ever had a negative dental experience that maybe caused you pain or made you anxious, and then you wait for the patient to respond? Now, while I have you here, and I like to repeat back to the patient what I heard, so it feels like we're having a two-way conversation. I'm not just asking a series of questions, and I'm not robotic, and I'm not low tone when I'm asking these questions. This is a two-way communication activity with you and the patient. So while I have you here today, Miss Johnson, I know that you said you have a couple cracked teeth that you want me to look at, and you're just trying to reestablish your care. Once we take care of those basic needs for you, are there any additional improvements you would like to make to your smile? If you ask this question, you should know usually the top two answers you're going to get. Yes, I would like for my teeth to be whiter. Yes, I would like for my teeth to be straighter. So now you're really upselling as well. So if you offer whitening services, now you can add that onto the treatment plan, even though that's not something that they originally came in for. If they say, I would like my teeth to be straighter, now you might potentially be able to add on any type of clear aligner treatment that you might be offering in your office, or if you do traditional braces, that may be a conversation you can have with the patient as well. Okay, so not only have we made the patient happy, but we're upselling and generating additional revenue for our practice too. Now, number six, did you have a budget in mind for your treatment? If your office doesn't offer implants, don't say implants, right? But treatment, so do you have a budget in mind for your treatment? This is also can be a question that sort of knocks the patient off guard. Like, what type of question is that? Why are we talking about money? I thought I was just here for get my cleaning and my x-rays, right? So again, like I'll say to the patient, you have a couple of teeth that are cracked. I'm regurgitating to them what they said to me. There can be several ways to replace a tooth that's cracked. And I just want to make sure that the doctor keeps that in mind as they're recommending treatment to you. And once you phrase it like that, they're like, oh, okay, I understand. Or some people will say, no, I don't have a budget. Understand. So if the doctor says that there's a lot of work that needs to get done, are you financially ready to commit to something like that? Or that brings us to question number seven. Or would monthly payments be something that interests you in order to move forward with your treatment? Right. So you get to phrase these questions however you need to fit the conversation, but you just want to be familiar with the questions. We've been using this for 6 years in my practice. We are a $2.7 million practice with 10,000 patients. I can assure you that these questions work. And if you do them properly, you will uncover the patient's objections from the front end versus trying to figure it out on the back end. Okay. Now, once we sort of warmed up this patient to talk about money a little bit, now we're going to move down to eight, which is handling the fear objection. Do you have any dental anxiety or any other obstacles that will stop you from getting care? And we flat out ask them, is it fear? Is it your schedule? Or is it finances that will stop you from getting treatment? And then let the patient think about it and then answer you accordingly. Last question is, do you have any questions for me? Right? So that is our pre-consult questions that you would ask your patients once they arrive and they are now in your office to get them warmed up. We would take this pre-consult and we're now going to scan it into the patient's chart, and then we're going to give it to the doctor. And then the clinical team is going to move forward with x-rays. What this also does sometimes is, and I'm sorry, I'll throw in this little caveat. In my office, new patients don't get a cleaning on their first visit. They are seen by the doctor and not the hygienist. So these techniques are really more so tailored to giving your undivided attention to a new patient during their first visit, going over the treatment plan with them and helping them overcome objections or obstacles that would stop them, and then getting them scheduled. Okay. So when I say we're giving this sheet to the doctor and then my clinical team, that is because my new patients are seen by my doctor. It could be a little difficult to do this if your patients are running through hygiene. But the concept of these questions will still get you the results that you're looking for. You may not get maybe the same type of results, however, again, if you're running new patients through your hygiene department. So just wanted to throw that little disclaimer in there very quickly. But in my scenario where new patients are going through the doctor's schedule, clinical team is now going to take x-rays. The doctor is now going to look at the pre-consult and sort of prep themselves to engage with this patient. Because we should always be thinking with, we want this patient to say yes to the treatment. That's it. We want this person to get the care that they really, really need and that they deserve. Okay. So as the doctor is reading over the pre-consult or the treatment coordinator is regurgitating this information to the doctor, x-rays are being taken. The patient is also now too sitting with those questions that they just answered, right? So now they can have a more informed conversation with the doctor once they actually come in. Okay, so let's jump right into confident case presentations. This is what to say and what to avoid. Okay. Now, before you can sell dentistry, you need to identify what you're selling. Here is one of the biggest mistakes. A lot of offices think they're selling crowns, they're selling root canals, they're selling fillings. You're not. You are selling health, comfort, confidence, or quality of life. The patient has a problem. They're either unhealthy, they're having pain, they have low self esteem, or they do not like their appearance. And so the services that you offer are preventative services, restorative services, and cosmetic services. That's really how this is broken down. I would love to see offices spend less time talking about the actual procedure, which is the root canal, the crown, etc. And let's shift our perspective and start more so talking about the problem, right? Let's start talking about what services we have to fix the problem, right? So is it the health we're trying to fix? Is it comfort for the patient? Is it the confidence or is it the quality of their life? And you have to identify what is important to the patient before you even start having a conversation with them. If you automatically think that, I don't know, confidence is important to the patient, and you talk about maybe, the job that they might need to get, or just, hanging out with their family or whatever. That may not be a motivating factor for them, but pain may be a motivating factor, or being healthy may be a motivating factor, or maybe quality of life is the motivating factor. You have to figure out what is important to that patient first. Is it the fact that they're unhealthy, they're in pain, they have low self-esteem, or they don't like their appearance? They're going to fall in one of those categories. Remember, patients buy because the thing that you're selling reduces or alleviates their pain, promotes some type of pleasure for them, or it just logically makes sense. So here's some exact phrases that you can use. You can take these phrases, you can use them in your office today if you're still at work, or you can start to use them literally tomorrow. So what to say? Once you've gotten to the x-rays probing and you're going over the treatment and you're talking about how this is going to change their life in some type of way, the phrases that you can use are, this treatment is going to help you avoid future pain, expenses, and time off from work. We've probably used that one before too. Like, don't wait until the filling grows and turns into a root canal and a crown and a buildup. It's just going to cost you more money with major services, right? Or if you take care of this now, you don't have to worry about taking off of work, right? And this very large cavity disrupting your life, right? Because it's gotten bigger or out of control. Or let's handle this now so we can alleviate future pain in the future. So maybe you're showing the patient that they have a huge cavity that's close to the nerve, but they're like, but it isn't causing me any pain. But let's avoid future pain because we're showing them on the x-ray, the dark circle, the radiolucency, the abscess, whatever it is that you use to show your treatment, right? We're showing this to them and we're saying, it's not hurting you right now, but I do want to help you alleviate pain in the future. Remember, this is a partnership between you and the patient. If you want them to commit, you have to become their ally. You have to become their advocate. You have to make sure that you protect them. So I want to protect you from future pain. I want to protect you from future expenses. And I want to protect you from this thing disrupting your life in a negative way. Another statement that you can say is the goal is not just to fix the issue, but again, protect your long-term oral health. Let's look at the benefits: comfort, confidence, and lasting results, right? So maybe it's a cracked tooth and it's a crown that the patient needs, right? So not only is this going to be more comfortable for you, but it's going to give you that confidence that you're looking for, or it's going to give you that lasting result, okay? Or you can tie in any other benefit that's important to the patient, right? So maybe the benefit is getting them out of pain. Maybe the benefit is quality of life, eating that steak again. I can't begin to tell you how many patients say, I just can't chew my food properly, right? So that goes back to, again, that comfort and lasting results. This is especially important with those permanent services that we offer, okay? Here's something else that you can say. Here's what solves for you. So remember, they came to us with a whole bunch of objections or a whole bunch of concerns. And now we're going to tie that back into our case presentation, right? So you have a tooth that maybe needs to be worked on, have a crown, have a root canal, etc. Here's how this root canal solves your pain, or here's how this crown solves your pain, or here's how moving forward with your treatment solves your pain, or helps you with your confidence. So we're just tying in what they said to us back into the conversation, right? So here's what this solves for you both now and down the line. So future complications that the patient may not even be able to see, now as an advocate, you are alleviating those things for the patient. Okay. And then for those patients who have a financial concern or time is a concern, let's walk you through how this fits into your goals and your lifestyle. Okay. So these are, again, just some things that you start to incorporate, things to avoid. I've heard some doctors say, I know this is expensive, but you really need to get this. Don't say that. This isn't expensive. This is their care. This is an investment. People buy what they need. People buy what they want. And you just have to explain it to them that way. Your insurance isn't going to cover much of this. Even if you're in network with insurance companies, I am not. I'm only in network with two. But even if you are, and I've worked in offices that are, you should never let insurance dictate the quality of care for your patients. So let's think of insurance as a discount. You're going to get $1,000 discount off of your treatment, $1,500 off of your treatment, $2,000 if you got a good plan. So insurance is going to cover about $1,500 of this. The rest of it is going to be your responsibility. The great part is we take cash, credit card, or if you want to do monthly payments, we have great partners that can assist our patients with paying for their treatment over time. That's a much better way to phrase it. Okay. This is your standard treatment. Or other things I hate to hear in offices. It's just a small cavity. If you don't make it important, if you don't make it sound urgent, if you don't make it sound major, right, then the patient won't either. Giving the patient the choice. Technically, it is their choice, but again, our job is to advocate for them. So by saying, so if a patient says, oh, I'm unsure, doc, and you say, well, it's your choice. I'm just giving you your options. Again, you sound very lackadaisical. You sound as if you don't care. You're not putting any type of urgency around the need for them to take action, right? So it is their choice. My job is to give you the best choices to get you back into proper health or get your mouth back into proper function. So here are your options. Which one do you think is the best option for you, which will solve your need, but also fit into your lifestyle? That's a way to present choices, okay? Where we're getting that person to still commit. We're not leaving it open-ended and waiting on them to get back to us. Saying to the patient, I know it's a lot, right? Now, they may not be thinking it's a lot, but you just told them it's a lot. And now you could be potentially bringing anxiousness into the conversation, which it will ultimately lead to another objection. And we don't want that. Okay. So I like to say it's easy. This is easy. We do this all the time. I reassure them we do this every day. We do this with tons of patients, right? And so not it's a lot. This is easy. We do this all the time. You're in great hands. You have great care here. Hopefully it won't be too bad financially. That's just not how we want to tackle finances. And let's see if you can afford this. So those are just some statements I would avoid using. Now, how to handle some common objections with ease. There are many objections that a patient can bring up, but these are the most common ones. If a patient says, I need to think about it, this is one of the statements that I love. It's totally fair. Can I ask you, what specifically do you think that you would think about? This is one of the techniques that I use for clarification, right? I want to make sure that when that patient goes back home, what are they going to think about? And did I answer all of their questions today? Sometimes what it does is it opens back up the conversation for me to go back in and reassure them about their treatment. And then it allows me or my treatment coordinators or my doctors to get that patient to commit that day. So what, can I ask you what specifically you're going to think about when you go home? Oh, I just got to figure out how can I afford this? How can I, just incorporate this into my life? I got a busy schedule at work. And then we work through those objections again. Why have them go home and try to figure it out? Isn't the best place to figure it out with us in the office? So that way, if they have any additional questions, we can answer them, right? Um, if they say that it's timing or cost, um, asking them if any of these are true, right? And now you can interject some things that they might be considering or some things that you've heard other, patients say, and now you can bring that into the conversation. Another follow-up question that you can ask if a patient says, I need to think about it. What would need to happen today in order for you to feel more confident moving forward with your treatment? Or another question I like to ask, which is not on here, but it's very similar to the one that's on here, is I'll go back to, is this the right office for you? How was your visit today? The treatment that was presented, do you feel it was the right treatment for you? And if you feel it's the right treatment for you, do you feel it's the right doctor for you? Especially this is important if you have multiple doctors, right? But I want to make sure that the patient feels comfortable and confident. And I want to get them to open up and talk to me so that way we can go over anything again that might be stopping them from saying yes. And then reassuring them, because we don't want to seem too pushy now. So reassuring them that we can give them time, but then saying to them, would it be helpful if we recap the most important points together before you decide? And the patient saying yes. Keep in mind, it can be super overwhelming for a patient when they come inside the office and we tell them about all this work that they had no idea existed. So not only are we giving them bad news, we're telling them that their mouth is in bad shape, and then we're slapping a big ticket price on it at the end. And they already are telling us that they don't like us and they don't want to be there. Right? So we just want to constantly reassure the patient. We don't want to be pushy. We don't want to have lack of empathy. We want to be compassionate. So let's recap everything for them. Let's slow down. Let's recap. Let's again partner up. Let's do it together. Okay. If they say it's too much, um, totally get that. This is a big investment. Would it be helpful if we looked at ways to maybe phase your treatment and walk through the financing options? Now, I do try to stay away from financing options. So I like to say, monthly payment options, or can we break this down into small chunks for you, etc. Also stay away from words like budget. I'm using them for the sake of this presentation, but in your office, choose another word than budget and financing. These are trigger words for patients. Okay. Another follow-up you can have if a patient says it's too much, out of curiosity, what were you expecting the cost to be? Or what were you expecting today? And remember, in that pre-consult, we already asked them, do you have a budget for your treatment? So we can bring that back in as well. Okay. Now, we can say to them that, well, that makes sense. Some patients feel the same initially until they see what it prevents or saves them from down the road. So this is value proposition where we're bringing in again something they may not even be thinking of. This is going to prevent you from X, Y, and Z, or this is going to save you from X, Y, and Z. This factors into your quality of life. This factors into your health, but also it may seem like it's too much for you right now, but if you let this progress, it's not going to go away. It's just going to become more unbearable. You're going to have more pain and it's going to be more expensive. How can I help you fit this into your life? All right. Last one is, what's more important to you right now? Moving forward with the best option or holding off and potentially needing more work done later? I love this follow-up one right here. What's more important to you? Because it helps patients reframe how they're thinking. Patients will talk themselves out of the work. Your job is to talk them back into the work again that they need and they deserve. We aren't selling anything the patient doesn't need. We aren't selling anything that the patient doesn't deserve. We're just trying to help them understand that it's okay to say yes. And we're going to be able to do this very painlessly and it's not going to break the bank, right? So at reframing to that patient, what's more important to you right now? Moving forward with the best option or holding off until you potentially need something more later, right? Or what's more important to you right now? Is it the quality of work that you get or is it the amount that it costs, right? Or what's more important to you right now? Is it getting this work done right now while you're not in pain? Or is it holding off and getting this work done later on when you are in pain and you maybe have to disrupt your day because you're coming back to us, because something flared up? Like what's more important to you? And I say that and tone matters. So I say that in a very, very calm way. What's more important to you right now? And it has a sense of curiosity behind it. Okay. Those are more advanced sales techniques. But last one is that financial conversation so that we don't scare people off. So how to present those numbers. So we're talking about what the treatment prevents. So let's look at what all of this treatment prevents: emergency visits, higher future costs, unexpected time off from work. That's the real saving here. Or you could say many of our patients are surprised by what's possible once we walk them through the options together. I like to reassure them that they're not alone. So I love to use language like many of our other patients or most of our other patients, right? It lets them know again that we do this on the regular. Okay. So many of our patients feel just like you until we walk them through the options together. Do you mind if I walk you through the options together? Okay, go ahead. Right. So partnership, two-way conversation. Something else you can say is this isn't just fixing something. It's protecting your confidence or it's protecting your health or it's protecting your peace of mind. Right. And then shifting the focus again away from cost and back to life benefit. Something else you can say is most patients see that this is a long-term investment. They're trying to avoid bigger problems later, right? I don't know if you're in the same boat or not. So again, bringing that patient in to what most people do and then having them reevaluate themselves to figure out which category are they? Are they going to do what most patients do, which is see the long-term investment, or are they just going to wait and hold off, right? And so most patients will reframe themselves in their mind on their own if you ask these follow-up questions. Now, once the doctor has presented, and in my office, my doctors actually do present the fees. Studies show that patients are more willing to accept their case acceptance if the doctor presents the fees. But maybe you're a dentist on this webinar and you're not ready to do that. Maybe your treatment coordinators are much better at talking about it. That's fine, but we still need to have a handoff where this information doesn't get broken down in the process. So what did you talk about with the patient? And now handing that over to your treatment coordinator to make sure nothing gets lost in translation, right? So handoffs should not be rushed. They should not be vague. They should not be disconnected. If you do any of those things, the patient will lose confidence in the whole entire practice's ability to take care of them. They're going to start to question the value and the urgency of their treatment. So once you've gone through your case presentation, we don't want to say, "Hey, Jen, Miss Johnson, she has that treatment. Can you talk to her about her fees? Or can you talk to her about her treatment?" That's not what we want. What we want to say is, "Miss Johnson, Amanda's going to walk you through exactly how we'll get you started. She is amazing. She's going to help you answer all of those financial concerns that you have, or maybe it's time. Amanda's going to help you fit this into your schedule, right? Or maybe a sphere. Amanda is going to walk you through the process of how we take care of our patients who are anxious. You're in great hands. Do you have any questions for me before I leave you in Amanda's hands?" Okay. You can also say, "This is what I recommend for my own family, right? Or this is what I would recommend for myself. And Amanda, she's going to take great care of you from here. Now that we have talked about your treatment, you've asked me all the questions that you have. Amanda is going to help get you scheduled and help you with any other obstacles you might be facing." Okay. Or you can say, everything we just discussed, Amanda has it. She'll make sure you're totally comfortable with the next step. Basically, we just want to reassure the patient when we pass them to another team member. Because remember, each step of the way, you're building trust. So they just built trust with you as a doctor. If they've never met Amanda before, we have to build trust all over again. Or if you don't convey objections to, let's just say, Amanda, right? She'll miss out that the person is concerned about finances or fear, and she'll just dive right into the treatment plan. And she won't incorporate any of those objections into her own treatment presentation when she goes over the fees with the patient. So it's important to hand it off where it's like, "This is Miss Johnson. She is super concerned about how she's going to fit this into her lifestyle. She is concerned about time. She has a very busy and active schedule. And she does have a little bit of fear because maybe in her childhood, she didn't have a great experience at the dentist. Amanda, I want you to help Miss Johnson with all three of those objections. I've talked to her about the treatment that she needs. I've talked to her about the solutions to her problems, right? She has agreed that she understands. She has said this is the right treatment for her. Can you please take her the rest of the way? Give me a call if you need me to come back in." So that way we reassure the patient, like, I'm leaving, but I am only a call away if you need me to come back in. Okay. This is a visual of that patient's journey and all of the conversion parts. This is the part I want to focus on. They only become a customer until they pay. Up until that point, they are a lead. They should either be paying in full, making a partial payment, or maybe they have a copay and insurance is going to take care of the rest. There are a lot of steps to get a person to say yes before they pay you. So this isn't about your dentistry or the services that you're providing in your chair. This is about understanding the patient and what they have to go through before they even get to that point. And with that being said, that concludes our webinar for today. What questions? I'm going to open up the floor to what questions do we have about case presentation, case acceptance?
Yeah, thank you, Ashaunte. Excellent presentation. And I want to give you the attendees, our members and staff teams, the opportunity to ask any questions, chat, Q&A box. You may even be able to mute yourself if you want to ask the questions directly.
I can certainly send, I see the question is, will we be getting copies of my handout? I can certainly send the link to the presentation to Jim and he can send it out to you guys.
And we've also recorded it, and we will share the
Okay,
presentation, in a few weeks too.
perfect, perfect. Love that. Any other questions? Any actual scenarios that you've had in your office that you might want to run through for a little bit, and see how you can apply these techniques in your office? You can either ask the question in the chat, or if you feel confident to come on camera, you absolutely can. I am yours for another few minutes. If you don't have any questions, can you at least tell me if this was helpful in any type of way? Feedback is always great. I like to make sure that I'm giving content that is valuable to team members that they can actually use in real time in their practice. So let me know if this was helpful for you today. And these are things that you can actually take back into your office and start to use right away.
And also add if there's any other future topics you want us to cover, please include that as well.
You're welcome, Cindy. Thank you for the time. I appreciate it. Yes, it was helpful. Thank you so much. I'm hoping that you guys can start to use these right away. I am available as well for any follow-up questions that you guys might have. My passion is dentistry. I've been doing it for 22 years. Um, I want to make sure that we bridge the gap between patients and providers and service to patients. Very helpful. Thank you. Thank you so much. Thank you. I'm glad it's very helpful for you. I'm looking forward. Hopefully, Jim can let me know how you guys do in your office when you take this stuff back. So my practice is in the Washington, D.C. area. I'm in Laurel. My doctor is Garland Davis, DDS, in Laurel, Maryland. And again, we have 10,000 active patients. We attract about 1,200 new patients every year. And this year we're striving to do like 3+ million. We really want to get to 5 million. So we're finally able to get there. I will provide Jim with all of my contact information so that way you can email me or text me. I'm always available to team members that need a little bit of help and guidance. Thank you so much, Cindy. I will keep up the great work, the Lord's work every day. Thank you. I'm glad all of this was helpful to you all. I really appreciate your time. And Jim, thank you so much for having me. It means a lot to know that somebody wants to hear what I have to say.
Yeah, it's our pleasure having you, Shante. And looks like there was actually one question I see. It said you mentioned asking budget, but I thought we should stay away from that.
Yes, I do like to change that word. I don't care for the word budget, so I tell my team that I know the form says budget, but I'll just say, is there a price point you would like to stay around? So in office, I stay away from budget and financing. I have seen the reaction of patients when you say it, and I can tell that it's a trigger word, it's a trigger language. So I just try to stay away from it. So you can I'm not sure what else you could use, but I tend to just say, is there a price point you would want to stay around? Or is there maybe a ballpark of an investment you're considering for your treatment? You can get super creative with this, right? Find your own language, but just try to stay away from those two words. Can I please share the forms? I cannot share the forms, unfortunately, because they are part of my program. But I hope that in the slideshow, though, you'll be able to see them, and maybe you can create your own and duplicate it in that manner. But I can't actually share the PDF versions, unfortunately. Sorry about that. You're welcome. Sorry. Um, but if you blow it up, hopefully when you guys you'll get the video recap and you'll get the presentation. You should be able to blow it up, and that will point you in the right direction of where you need to be. Okay. All righty. I think that concludes our webinar. Jim, I will send you over just my contact information for them and the PDFs for today. And and that way you can include it with a recap of today's webinar.
Okay, well, thank you again for being with us, and thank you for all joining us, and have a good rest of the day, everyone.
Thank you so much for having me. Thank you, everyone. Have a great day. Thanks, Jim. We'll talk soon.